It's only like 10, but it feels.
All right, folks. So I'm going to begin. As you heard, this press conference is being recorded. Just again, good housekeeping rules. Keep yourself muted unless you are asking a question. So thank you for joining us. My name is Noel Schultz. I'm the Provincial Director of the Manitoba Health Coalition. I'm speaking to you from Treaty 1 territory in Manitoba. The Manitoba Health Coalition and our fellow health advocates have been sounding the alarm about the dangers of paid for profit plasma collection for quite some time, and most recently, since learning about the deaths of two Manitobans following visits to Grifols collection centers here in Winnipeg in October of 2025 and January 2026. We remain very concerned about donor safety and the risks of allowing this profit motive into plasma collection. Today, however, our focus is on Rodiyat Alabede, a 22-year-old international student who was studying to be a social worker in Manitoba, and the circumstances around her tragic death. So I am joined by Kat Lung Tang, a Safe Blood patient advocate and former executive director of bloodwatch.org. Kat is here with us to make a statement on behalf of Rodiyat's family regarding the circumstances around her death. We will have time for follow-up questions, but encourage the media to reach out to us subsequently as well, and you have the information you need to contact both of us in the chat. So I'm now going to turn it over to Kat to share what she knows.
Noah, just as a housekeeping, can you add the people that are coming into that are in the
Yeah, I continue to admit as we go.
Okay, thank you. I wanted to thank everyone for attending today. I have been retained formally by Miss Alabede's family to be their patient advocate. And I am here to correct the record on the circumstances surrounding Miss Rodiyat Alabede's death at Grifols for-profit collection site in Winnipeg, Manitoba on October 25th, 2025 on behalf of her family. Miss Alabede died of a sudden cardiac arrest due to dilated cardiomegaly. She had an enlarged heart. That is the cause of death that was revealed in her autopsy report. After carefully reviewing Ms. Alabede's autopsy report, significant medical discrepancies have been found between her autopsy and the medical summary Health Canada wrote on March 27th and subsequently distributed to legislators. We have now been able to determine that no attempt was made by the medical examiner's office in Manitoba to investigate the nature of the plasmapheresis events or of the multiple pathways plasma donation would trigger a cardiac arrest in Miss Alabede. This includes, but is not limited to, the fact that no efforts were made to test for citrate toxicity or to ensure the machines were set up properly and alarms were being responded to during her donation process, or to understand how much blood volume had actually been taken from her. To be clear, the pressure and stress a plasma donation would put on a donor's heart with this condition would be profound due to the hemodynamic stress it would cause, even in a donation that was being conducted in a safe manner by a facility being run safely. However, plasma was not being extracted safely from donors at Grifols facilities. In fact, a perfect storm had been created for a donor like Miss Alabede due to Grifols' egregious lack of safety protocols, which have now been exposed through a damning inspection report conducted by Health Canada inspectors 4 weeks after her death. Miss Alabede had a cardiac arrest during her donation process, She was pronounced dead minutes after arriving to St. Boniface Hospital. There are substantial clinical events that took place which may have precipitated instability in a vulnerable heart. Not only is there a direct correlation of Miss Alabede's death and her plasma donation, the facts we have today demonstrate that there may have been multiple contributing factors to her death, and none of them are her fault. She was not riding a bike or going for a swim when she died. She was donating plasma, which is a medical procedure, which is regulated federally by Health Canada. We have written to Prime Minister Carney asking that he ensure an investigation is reopened into her death and that Grifols' license is suspended in the interim. Excuse me. Miss Alabede's family wants to ensure this never happens to anyone else. They have lost their beloved girl. It is a tragedy that has added to their grief because it is evident that no care or concern was made to find out the truth of what happened to her. Rodiyat donated that day to save the life of another person. She did not go to Grifols to die. Thank you.
So we will now open the floor for a few questions, but like I emphasized at the beginning, we also encourage you to reach out to us directly for follow-up. So if you would like to ask a question, please, use a react or even put it in the chat and I will unmute you. Did you take my warning of no question or limited questions too seriously, folks? No, it's a lot to digest. Okay, Gabe, where are you in the chat here?
Okay, to just unmute and
Oh,
ask.
if you can unmute yourself, go for it.
Yeah, thanks, Kat. So as somebody who does not know heart stuff very well, am I understanding that Rodiyat had a pre-existing sort of heart condition, and that it is your belief and the family's belief based on the available information that you have or they have gathered that there may have been, something that happened during the plasma collection process that triggered her death? Are those the two pieces? Am I understanding those two pieces correctly?
Yes. So a donor with cardiomegaly should not be donating plasma, somebody with that condition. To make it clear, it is unknown whether the family does not think that Rodiyat knew that she had the condition. So just to make that clear, and right now it's a moot point in many ways. The reality is that somebody with that condition, a plasma donation would cause a adverse reaction because their heart would not be able to sustain the plasma donation in multiple ways. And so that is clear, and Health Canada officials know that. What I believe is happening is that because somebody with cardiomegaly can have a sudden cardiac arrest, regardless of what their circumstances are, that Health Canada and Grifols Pharmaceuticals are clinging to that and saying, oh, well, she had this heart condition, so there was nothing about her plasma donation that could have gone wrong. That is scientifically and medically incorrect. The discrepancies between the medical examiner's report and the report that Health Canada has distributed to legislators is profound, including different amounts of plasma that they say was collected from her. From a scientific point of view, that is very significant because we believe that alarms were going off instructing the staff members to stop her donation, and that was possibly not adhered to. So there are many issues surrounding this. We also understand that the medical examiner's office took the information from Grifols that they used for their investigation. And so I have found no evidence otherwise in all of the data and the paperwork that we have right now that any efforts were actually made to find a link or to understand if there was or was not a correlation to her plasma donation.
Kristen, go ahead.
Hi, good morning. So do we know yet if this was the first time Rodiyat had donated plasma?
Thank you for asking that questions. We have been asking for all of Rodiyat's health data to be provided to her family. Health Canada has not responded and has essentially refused to provide that data. We received an email late yesterday from Grifols in Manitoba, which we believe is that they have now agreed to provide her donor records to the family. So we are waiting for those.
I think your hand is still up, but possibly you're done with your questions. But if you have a
I
follow-up,
just have a second
ahead.
follow-up question.
Sure.
Do you know when Health Canada first reached out to Rodiyat's family? Do we have that date?
Health Canada never reached out to Miss Alabede's family at any time. No one did, including members of the Manitoba government. Nobody has helped this family to find answers as to what happened to her daughter. It is an egregious violation of any public health actions due to a death of this kind, and we are looking to remedy that. I have reached out multiple times to the minister's office, multiple times to the director general's office, multiple times to the assistant deputy minister's office, multiple times now to the director general of compliance, asking for a meeting so we can move a path forward and provide transparency for this family.
Gabe, go ahead.
Given that she had this heart condition, well, I guess there are two questions. One, did she know she had this heart condition? Did she tell Grifols she had this heart condition? Should she have been screened out if she had this heart condition? Can you shed any light on that?
So we do not think Rodiyat knew that she had this heart condition. We can't speak to whether they screened her properly or not. It's very difficult to make that assessment because in the inspection reports, the investigator states multiple times that Grifols provides Health Canada with information that is completely factually inaccurate. And because Grifols is so dishonest, we don't know whether they screened her properly. We don't know whether they responded to her donation process properly. When you read those reports, there is no other answer other to the fact that they're damning. They had staff taking plasma from donors who did not know how to extract plasma in a safe manner. They did not know how to respond to the codes in the machine, which would instruct them to stop the process. They did not know when or when not to put back whole blood into a donor during the process. They are so egregious that now we have more questions than answers. But I want to make something clear. We now know that there are multiple donors with underlying health conditions that should be getting identified by Grifols through proper screening processes. And we know because of Health Canada's other reports that they are failing to screen donors properly. It's company-wide across the country. We know that they are taking plasma from high-risk donors whose plasma should not be entering the blood supply. So the actions of the company through Health Canada's reports speak for themselves. So I find it incredulous that with the donor that actually had a fatality during the process, that they did anything right.
And just to add, we know as Kat has said that there is a pattern of non-compliance across Grifols sites, and donor screening being improperly done is one of those common threads. And that's a very deep concern because these sites continue to operate despite non-compliance ratings. Yeah, go ahead, Kristen.
Just on the other side of things, from Grifols' point of view, if it was a pre-existing medical condition, why should the company be blamed for the death if she herself, she had an enlarged heart, and it was this idea that it wasn't the donation process that contributed, rather it was her enlarged heart.
No, somebody's medical condition, whether it is known or unknown, does not abdicate a company's responsibility from ensuring that their plasma donation is safe and that the response to an adverse reaction is done in a way where staff are trained to respond. That is a ludicrous principle and presumption. That it should be duly noted that it is highly likely that people who do have cardiomegaly have donated plasma before and survived, and that there are no deaths in the public system, either by Canadian Blood Services or Hema-Quebec. Their record demonstrates that they were extracting plasma from donors at that facility in an unsafe way, and that they had been doing so since 2022, including in the donor that had a kidney failure due to their failed abilities to collect plasma safely, and that donor has long-lasting kidney damage. None, absolutely, the company, Grifols Pharmaceuticals, and Health Canada's complete lack of enforcing the Food and Drugs Act has led to donor harm across this country, including 2 fatalities.
And we continue at the Manitoba Health Coalition level to, be very concerned about this, to echo the calls for a federal inquiry as well as a shuttering of Grifols. Certainly, we need a temporary hard pause to ensure that regulations are properly being followed, inspections are being done correctly, and non-compliance is being dealt with severely. And we don't have a lot of confidence in that at the moment. Kristen, follow up, and then Gabe.
Sorry, just in terms of when you say you're speaking for Rodiyat's family, is that her mom, her dad, just so we sort of have an understanding of who it is that you're in communication with?
I'm not going to speak about, I'm speaking on behalf of her family in a formal manner. Her family has provided high-level paperwork and signed documents that I am acting on behalf of her family. Her family's not going to be harassed and contacted. One of the things that we're most concerned about is we do not want Health Canada to start a circus regarding her death and drag their heels because we have exposed the fact that they did not do a proper investigation and that they essentially have helped cover up the circumstances of her death. The Manitoba government, as far as I understand, was not even informed that she died. This is wholly inappropriate. I have never seen anything like this since the tainted blood crisis. It is a rogue organization at this point. I have reviewed documentation through Freedom of Information requests that show that after the second death, Health Canada reaches out to the Manitoba government to discuss the issue because of the sensitive information, instead of suspending the licenses of this facility because 2 people are dead. 2 people have died, and their own reports are saying that these are systemic actions by the company that have to be rectified. They use the word recurrence. They use that word. We are responding due to Health Canada's inspections, not based on any kind of idea of what's happening. We have a lot more questions that need to be answered. But we don't live in a world of speculation. We live in a world of scientific facts. There is one story about what happened to Miss Alabede that day that she died at Grifols Pharmaceuticals facility, and there is only one truth.
Gabe, you can jump in and then we'll hear from Chris.
Yeah, I'm wondering if there is any evidence you have now that suggests to you that Grifols did do something wrong that led to Miss Alabede's death. Totally understand the inspection reports that have found systemic lack over sort of these various sites, but I'm wondering if there are any specifics you have now that lead you to believe that it was the plasma collection or some process related to that caused her death.
Yes, there are two. One of them is the inspection reports, because those inspection reports are in response to her death. And they're in response to the information that Grifols Pharmaceuticals gives to Health Canada. So those reports must be reviewed by the broader media in detail because of what they are saying and the story that they tell of what happened at that facility. Secondly, there are two different amounts of plasma provided by the company to Health Canada and to the ME's office. Those two stories do not align. It is either one or the other. So Health Canada states in their inspection reports that Grifols Pharmaceuticals issues inaccurate information. And that is deeply troubling. So we need to have full clarity, which is why we need a renewed investigation with independent professionals and experts, which includes a patient advocate for the family, to ensure that what has happened today never happens again.
Chris?
Hi, good morning. Chris Kitching from the Winnipeg Free Press. I did want to ask you about those that discrepancy, and apologies if that's been reported before because this is the first time I've covered this. I guess I was hoping to get a sense of that discrepancy, like how wide is it? What are the values that you've obtained?
It's wide. It's 3 times the amount. So the ME's report says one amount of plasma that was collected from her, and the Health Canada report says that it was almost 3 times of plasma that was collected out of her. So this is very significant because when you donate plasma, what is in the bag of your donation is not actually what's extracted out of your body, right? You actually end up giving between 10 and 50%, 15% of your entire blood volume. So that scientific data would be critical in understanding how much strain had been put on her and on her heart. I want to go back and make a statement if I can, because I'm very nervous on behalf of the family about speculation about her condition. The reality is, Health Canada and Grifols had a duty of care to ensure that all aspects of her plasma donation had been investigated. And if the medical examiner is not able to understand the plasmapheresis process, it was the onus on both Grifols Pharmaceuticals and Health Canada to ensure that he did. And that would include what actually happens during a plasma donation, ensuring that the correct amount that had been extracted from her was provided to the medical examiner's office to ensure proper investigation, to instruct the medical examiner's office to ensure that citrate toxicity was completed. That would cause a major strain on somebody who had cardiomegaly. It also would create a major strain on anybody who had particular underlying health conditions. And so none of that was done. The point I'm making is the reason why Health Canada and Grifols Pharmaceuticals made false statements that there was no correlation between her plasma donation and her death is because they didn't look. They did nothing. They treated her like she didn't matter. and they walked over her body. It is totally incomprehensible to me that our federal government would behave in such a manner, especially after the tainted blood crisis, when families across this country paid the highest price due to the egregious actions of Health Canada not regulating industry appropriately and not warning the public of possible harm. And today, they are doing the same thing. And instead of blood recipients, it's donors. And we are not working towards self-sufficiency in this country on the backs of the dead. It absolutely will not be occurring.
Thank you for that, Kat. Does anybody else have any questions? I think we've covered a lot of ground here. We're almost at 9:30. So again, you have our contact information should you want to reach out to myself or to Kat to get further uh, discussion on this matter. Again, the Manitoba Health Coalition, like other public health advocates, take a position that we are opposed to paid and particularly for-profit plasma donation or collection. We echo the concerns that Kat has shared. We want to see an independent and fulsome investigation into all the deaths connected to paid plasma in Manitoba. There have been three, the two most recently under Grifols' purview. And again, this is a matter of urgent donor safety as well as safety for the blood supply. The Manitoba Health Coalition has reached out to the provincial government. We hope to have them as partners on this to protect Manitobans. And to particularly push for a proper investigation into Rodiyat's death so that her family gets the answers they deserve and her death is treated with the dignity and respect it should be, the gravity of this situation. So again, thank you for coming, and I hope that you will all continue to follow up on this story and help us answer some of those pressing questions because we are not interested in speculation. We're interested in facts, but we need the facts to be uncovered by the appropriate authorities with the expertise. So, all right. Thank you again, Kat. Take good care, everyone. I will be available for comment throughout the day. So don't hesitate to reach out. Thank you again, Kat, for your time.
Thank you, everyone.
All right.